I want to welcome back all our speakers who are joining us now for the panel discussion. In addition to the familiar faces, I also want to welcome Dr. John O'Neill. John is the head of Research Policy and Innovation Unit in the Department of Health, which was established in 2024 to ensure that the crucial contribution of research and innovation to wider health system improvement is more fully exploited. John, you're very welcome, and I will come back to you in a few minutes where we talk a little bit about embedding research in practice. But I want to start with Colin as our first speaker today. You set us off on a path of discovery around the changing profile of addictions, responding to emerging needs. What do we need to do to ensure that we're not on the back foot against what seems to be a very changing landscape?
Yeah, that's an excellent question, Leslie. So, I think it's kind of a common theme that has come up today is the attitudes towards addictions, particularly process addictions, and the support and care pathways and service provision that these addictions are getting. To keep things moving forward, obviously we need to have adequate protections for people who suffer from these addictions. Also, we heard Anne-Marie talk about the social fund. This is going to go on with a wish list here. But look, in reality, what we have is people coming to us who are very, very unwell, who are very upset, families. The literature suggests about 8 people affected by one person who's in addiction. So we have hundreds of thousands of people affected here, as Anne-Marie has said. And the treatment provision is very poor. Okay, we're here in Dublin where we have access to fantastic community addiction teams where you get one-to-one counselling, group work, and complementary therapies. But in other areas of the country, we don't have that. And our mission really is to try and alleviate the suffering of individuals who present to us, but also we carry an advocacy for people in the rest of the country as well. And that's ultimately what we're trying to do. So to keep it moving forward and to answer your question, I think bringing people together today on this theme has been so incredibly important. I mentioned earlier that there's been a number of voices, Tony included in the past, and that have been advocating for people in this situation where they're suffering. But what we need is as many stakeholders on board as possible. Are the industry going to play a role in that? Of course they are. We'll have to have a synergistic relationship with the industry going forward in terms of what better protection and what can be done there. It has to be collaborative essentially, and I think Anne-Marie is going to be walking the line in terms of that between caregivers, the industry, and whatever. But my sense is that, and Anne-Marie touched on it in terms of the black market and the operators who have been paying a price for, ultimately for regulation. It is not going to be easy process at times, but everybody's got to come together for this, and people who are truly interested in helping the individual and the family members that are in that awful position, it'll be obvious whether they want to help or not. So, anyway, this is a long-winded answer there. Thanks.
Thanks, Colin. And I will pose a question to each of the panelists, and then we will open it up to the floor because I'm sure there's a lot of burning questions, and you've been very patient throughout the day. The same question, probably to you, if I may. You get the real message of hope in your talk when you refer to the change over the last 10 to 20 years, and that now you don't see young people with heroin as being the presenting channel. So what lessons can we take from the experience of navigating the challenge around heroin that can be applied to the new challenges that we see?
That's certainly a challenging question. I do think it is really important to retain a sense of hope, whether you're working with an individual who's in front of you or grappling with the big issues, I suppose, that addiction poses as a society. Examples like heroin And to some extent smoking as well, I suppose. These are, two areas where we're making an awful lot of progress. What made the difference with regard to heroin and perhaps smoking? I don't think one issue was that everyone knew where we were trying to get to in both cases. There was no ambiguity in the advice, the messaging from any sector of society. Everyone seemed to be on the same hymn sheet. And it's one of my concerns about the drug conversation happening at the moment. There's a whole range of disparate voices. There's all sorts of strange messages sort of emanating from different sectors, and there's no agreement. So the public are deeply confused as to where we're going to with drugs like cannabis. What is the actual plan? Is it legal? Isn't it legal? People should know. So at the board policy level, I think the whole messaging to the public has been incoherent, or that's incoherence in leadership. From a provision point of view, I think it's important to provide people with a rapid route out of addiction when they find themselves in that. And as Colin sort of alluded to, there is a bit of a patchwork quilt of services across the country. I think there needs to be a big ramp up in provision of addiction treatment. People shouldn't be left scratching their head if you're 20-year-old playing football and breaks his leg. People don't stand around for hours on end sort of figuring what do we do, where do we take him? Everyone knows what to do. If someone has an addiction issue, it should be equally clear. This is the service you go to. That service should be able to respond quickly and promptly. And I do think counsellors and the psychosocial treatment providers are really, really key within that.
Thanks, Bobby. That clarity around pathways becomes kind of complex when you bring something like different cohorts, like people with intellectual disability, into the discussion and into the treatment pathway. Evelien, you might speak a little bit to this about the importance of including people with intellectual disability in the conversation around how we tackle addiction.
Yeah, for me, there's no doubt that there's importance to take them into research and in your clinical practice, because they are there and they deserve the attention. They deserve evidence-based treatment. And I think yesterday at dinner we also talked about sometimes they're not a group that is easily to be included. And I think, well, maybe the designs that we use start from clinical practice. See what questions you have, what do you want to know, what don't we know yet, and start from there with your clients and measure something and write it up and make a paper. And sometimes it's also not common to publish outside of the field of intellectual disability about research in this group. But I think if you have the important questions and use a good design, you can also publish it, we have competition in addiction or behavior therapy. And I think that's also important because we know that in addiction care in the Netherlands, a lot of, and yes, that might be the same in Ireland or in other places all over the world, that people with intellectual disabilities are overrepresented in addiction care. Only therapists don't always know and recognize the intellectual disability. So they deserve it, that knowledge how to treat them and how to intervene should be shared across. So we have to share knowledge. Yeah.
Thanks, Evelien. And it does tie in with one of the points that you had made, Anne-Marie, in your last slides there, around more research needed with vulnerable groups and with people who are normally excluded or typically excluded from research. And I'll come back to you on that in a minute, but I want to move to Tony now. And firstly, Tony, thank you for sharing such a personal and emotional and sensitive account with us today. We really value that input, and it certainly is my impression from speaking with Anne-Marie and with Colin that you've done a huge amount of advocacy work in this area, and I know that you had to step out to go and do a 2-hour talk at a girls' school this afternoon. So thanks for coming back to us again. You very much finished on a positive message, a message of hope and of advocacy. But if you were to go back in time, what might have changed the pathway for you?
I believe education and awareness, like
because I didn't set out to become someone who experienced a gambling problem. So I think the education and awareness of how it can happen, and just to touch on, there's no, just to touch on what Bobby was saying, there's no pathways for people to go out and support. Like when I was trying to get help and support, I couldn't get some support because of the lack of, because it wasn't covered by health insurance, but there was very little, even the treatment centre I was doing my treatment, and very little information on it. Like I didn't share in my slides that they were running a draw in there that my wife won €500 and I get to check the fee. So I didn't share that part of the presentation. So we were far behind. I know it's a different landscape of gambling back then, but we definitely do need. I needed to know that I was drifting on that path, but also I needed to know how to look for help or where to look for help. And I think part of me didn't know how to look for help. Part of me didn't want to help because I figured I could gamble my way out of it. So stuff like Colin was mentioned, the sunk cost fallacy, the gambler's fallacy. I spoke about that in the second part of the presentation today in school kids. It's about learning about probability, learning about the psychology of gambling, and my story is to show that this is what can happen. I'm very much one of, I've come to mention the 80-20 rule. 20% might be impacted by gambling, but we do need to, I needed to know what was happening, because it was like, you ever heard an analogy of a frog being boiling in water? I sat there and didn't know what was going on. Before I knew it, I was stealing money. Then before I knew it, I was suicidal. Like, it was just like, I was in this bubble for so long. So if kids know, or society knows that this is what can happen, I think that can be a huge part. And just finally, to touch on Mark was saying about hope. We mentioned CBT a lot today. I was at a conference years ago with Christine Badesky, who would be very much a pioneer in CBT. I remember I've had like a sieve, but one line really stuck with me, or one story in her presentation. She said, like, as clinicians, we have to be the carriers of hope. And that can be people who are advocates, or people who are clinicians, or treatment provisions. And she said, when you have a client coming to you, especially with gambling addiction, the hope is gone out of their lives. I walked through the doors of Convert, I thought my life was over as a new one. But I felt there was hope in the room. She said, as clinicians, we have to be the carriers of hope, so that we can create an environment where hope of a new life is possible. And that's what I felt in recovery. And then the person finally gets that hope, and then they can bring it to the next person. So it's a very important point to make.
Thank you. Anne-Marie, to you, the research that's been conducted, especially what you've done since coming into post in 2024, has been really impactful. But what is the journey like to actually translating those findings now into policy change and into implementation? Because the likes of the self-exclusion register that you talked about seems like a no-brainer. So how easy is it to actually enact something like that?
And I think research is extremely important. I think across government generally, there's an appreciation of the need for evidence-based policy making. And that's something that, say, certainly in my last department, public expenditure reform, they would have had a big push on that. From our perspective, it's important because, for example, when I started out this journey, it was thought there was only 0.3% of individuals who were suffering from harmful gambling. That was the figure that was out there at that time. And when the ESRI started to do the research for us, and they discovered that actually it's 10 times higher. And they are so careful with their work, and they asked to take a bigger sample, and we agreed to that because we wanted to be absolutely sure, and got it internationally reviewed to make sure it was at the standard required. So I think research is very important. How you do the research is very important. Again, bear in mind that piece of research was online. It's very hard to make somebody stand up and going to do a clipboard, if you've actually gambled to the extent that your family is going without, etc. Whereas you might, admit that online and go gambling online. That's it's a good indicator as well. That's the way you do business. In terms of translating that then into policies, I suppose there's a couple of things. For us personally, our authority, our seven-person authority, does have the right to introduce further restrictions, but they'd have to be based on evidence. We'd have to go through, as you mentioned earlier, the consultative phase and so on. And we are also entitled to feed into government in relation to when this legislation will be reviewed in a few years' time. That's one of our roles, is to advise government in relation to future developments. And when you look in terms of what's happening in the space of AI, what's happening in relation to cryptocurrencies, etc., there's all sorts of new and emerging challenges there. So I think in terms of keeping on top of that, it's important. And just finally to say, even in terms of today's seminar, some of the topics, like Evelien had in terms of individuals with intellectual challenges, for them it's about a balance of, their right to decide to maybe engage in gambling, but on the other hand, it wouldn't be harming, it wouldn't affect them. And there's areas like the elderly and medications. There's so many different areas that we would like to learn more about, so that our interventions can be well informed and actually be effective.
Thanks, Anne-Marie. And now over to the department for your official response. But I'm interested, John, in what your unit does now to try and encourage the research that we're trying to do in St. John of God, and that's research embedded in the service where care is being delivered.
Sure, and good afternoon, everybody, and thanks, Leslie, and thanks for the invite. This has been really good from my point of view, and from the department's point of view, to be here to listen to all the really amazing talks. Just to give a brief, so we have a kind of a policy unit on kind of research within the department. We work very, very closely with the HRB, who have been mentioned kind of previously. We also work very closely with the HSE, so the research and innovation side, that's there, and even trying to work through the regions as well, in terms of the changes that are happening at the moment. We also try and work across government, so we have a kind of a wider agenda, let's say, on the research side, trying to bring health into other policies as well, and kind of things like that. And then we have the international and EU side of things, which is going to ramp up next year, obviously, with the EU presidency, and kind of so forth. But actually, so that's a very broad kind of overview, and it is a very broad agenda. But it goes back to maybe kind of, Anne-Marie mentioned the evidence policy, and I think this is really about kind of that big challenge about kind of, and it's not just for policy, but it's for the services side of things as well. So it's kind of how do we bring, from our side, it's the big challenge about how we bring the research community and the policymakers closer together. So kind of this is a really big challenge that we've kind of just constantly see we're kind of trying to get on the same page to a large degree. Sometimes we're really poor at communicating what our priorities are, and we need to work on that, and actually. And often our priorities change very quickly too. So how can the system be really agile in that respect? So there's different things that we're working with, not just within the department, but with our colleagues in the HRP as well, about kind of how we might kind of think about new ways of doing that, and kind of, but not just, as I said, kind of purely for the policy makers, but also then kind of how we can get kind of into the services kind of much quicker as well. And maybe the last point on that is kind of about the implementation. So it's kind of how do we kind of make sure that we really have a really strong focus on implementation, which is often around, I suppose, and very much this area, the governance structures and kind of how you have them. But if they aren't effective, it's really, really kind of challenging to try and do that. So it is about trying to do things a bit differently, but it's about that kind of collaboration and making sure that we're kind of communicating what we actually kind of need, and that kind of that's coming through. For, I think, kind of what Tony was mentioning maybe earlier, about the impact you can have with the actual research itself.
Thanks, John. I'm happy now to open up, and I thank you again for your patience. I'm sure there's some questions that have been burning since early morning. So if there's anybody that does have a question they want to ask, please go ahead and raise your hand.
Okay, I think I'll start with Anne-Marie. It was very interesting to see how solid your regulatory authority has. I just wanted to hear from experiences what has worked since 2024 and what has been some of the challenges. Because where I come from, I think the regulator seems to be in between, like the gambling companies, then there are the users, as well as the service providers and ourselves. And then the other side, listening to Professor O'Gara and Smyth, there seem to be a lot of serious impacts of the other forms of addiction. But like where we come from, they seem not to be very good enforcement, apart from maybe having solid legislative and policy framework. And I would say, okay, who is responsible for regulation and enforcement for the other things like cannabis and others? Yeah, thank you.
Okay, thanks, Charles. So we'll start with you.
Thanks, Charles. I would say in terms of the last couple of years, one of the things that we have invested a lot in, and it's really paid dividends, is stakeholder engagement. So we have had all of the big gambling companies in, we have sat down with them. Some of those conversations might have been a little bit uncomfortable in terms of fines and, procedures taken against them in other jurisdictions, why it happened, how would they ensure, when they're here in Ireland that won't happen. We've also met with people with lived experience. We've benefited hugely from that, from people working in the field of assisting in treating people with problem gambling, and then a whole range of areas like research, education, awareness, people dealing with the regulation of advertising, commissioning on, the media commission who deal with, that whole area. So I think we've a lot of stakeholder engagement, and other gambling regulators have assisted us massively. The UKGC have given us so much documentation in terms of compliance and enforcement that you mentioned there, in terms of what works and what doesn't. And they, because some of the operators work across various jurisdictions, the bigger ones, that collaboration and that close cooperation is going to be really key in the future in terms of working together, so that we can share what works well and what doesn't, to try to avoid it. In terms of what hasn't worked well, I suppose the scale of it, it's a 15 billion industry in Ireland, and we are the last regulator, the last country in Europe to regulate this sector. So we have a lot to do and a lot to catch up to, a lot of time to make up, and putting those structures in place and so on. And having the resources and building up the resources to do it effectively it can be challenging, I would say. We will be self-financing in the future, but just at the moment, that's pretty true. Yeah, thank you.
Thanks, Emily. I think you have a question.
Yeah, hi, thank you. So my name is Elizabeth Cavan. I'm the addiction specialist in the CRS and Detect in St. John of God's Community Mental Health Services. And I just have two questions. I suppose one would be related up to Anne-Marie and potentially John as well. Just in relation to, I suppose, we can see so many, ads for gambling, the pop-up things for Heineken, for Guinness, even the new, I think they're called Velo or Nordic Spirit, the nicotine products. They're everywhere. They're, professionally and personally, you just see them in your day-to-day passing in the street. So has there been any consideration for collaborating with the likes of social media companies, even the likes of, RTE advertising and stuff, to try and balance that advertisement and marketing to the way that the public are seeing it, just as a prevention long before they ever need it, and a bit like what Bobby Smyth was saying in relation to, the pathways, the research, where to go to follow up with if your loved one, if yourself is having a problem. Because if you want to make a bet, if you want to go to the pub, and if you want to start smoking, you know exactly how to do that. And so that's my first question. And then my second question is similar enough in relation to, we're all very privileged to be able to understand the research and to conduct the research that's being presented today by everyone from different parts of the world, including Malawi and Ireland. But how do I, as a clinician, as a practitioner, use that research or get that research into the hands of clients that I'm seeing every day, day in, day out, who have done their own research via AI, via ChatGPT, via, every other kind of, I'm not going to say conspiracy theories, but, in relation to cannabis and how good it can be for sleep or anxiety or whatever. How do I get that? How do I translate the research that's being conducted by amazing people, not just the people on the stage? How do I get that into the hands of my clients who need that information? Thank you very much.
Thanks, Elizabeth. Bob, we might start with the first question to you, and that is the signposting and the pathways and this cross collaboration with other agencies to try and raise awareness.
Of substance use, sort of generally, and gambling generally. I suppose you got to look at the sources of information that's driving people towards any of these unhealthy behaviors, whether it's vape products, alcohol, cannabis, or gambling. And I suppose again, go back to our successes with smoking, we stopped advertising of smoking, and I do think there's lessons to be learned from that, because it's always going to be very difficult for any public health oriented messaging to outsmart and counteract the really glamorous, sexy, positive, phenomenally well-funded messaging that these industries are able to put together. And I think you're always going to swim against the tide of other influences, while they can advertise as well. So, my instinct would be for health harming products, you just shouldn't be allowed advertising at all. I'm a long way from winning that particular argument. So against that, I think all we can do is ensure there's good, high quality communication, make use of social media ourselves, recognise it's expensive on the issue of cannabis. There's a cannabis industry that now exists globally, if not in Ireland, and it's churning out this positive messaging. But there's been absolute silence from all statutory authorities in terms of communicating or trying to counter that messaging. So that's something that hopefully the next national drug strategy will address, and that's a strategy that's been drafted sort of as we speak and will hopefully be rolled out next year.
Thanks, Bobby. John, I might come to you for if you've any thoughts on the second part of Elizabeth's question, around how we get the information distilled from the research, from the findings, and into the hands of the people who are using the health services. Do you have a view on that?
Yeah, no, look, it's kind of, I think it's kind of one of the key challenges that we have. And actually, it's interesting because actually there's a huge amount of evidence already there. So even if you don't think about the new research that we might do, so there's an awful lot out there. And an awful lot of times it's about the evidence synthesis piece. So kind of taking what's out there and actually kind of using that in a systematic way to kind of come up with kind of things that you can actually kind of use tomorrow or the next day, or something in kind of a very short time frame. So one of the big challenges we would see at the HRB are again working with this on this is that from the policy side within the department, let's say we might say that we have a particular demand in like a certain area, and it could take 2 years to turn that around. And in that 2 years, kind of people have moved, or kind of the policy is completely different, even if the minister, whatever it might be. But actually, some of that is still going to happen through the HRB, and that evidence is kind of coming through the system all the time, but it mightn't be actually being used the way it should be used. That's it. So it's kind of, but then there's also short-term kind of plans, which I think are the really kind of key pieces around just kind of using the evidence we have and being able to kind of translate that into something that can be used, not just on the policy side, but in the service interventions as well. And I think that's something that we're kind of trying to see if we can do that better, which would have shorter turnaround times, which would have more impact. But it does mean kind of trying to synthesize things a lot better in terms of what's already out there. I think there's a figure that was something like when you actually are going to research a particular topic, 80% of this has been done before to a certain degree. So it's kind of, but it's not being used in a coherent way, and that's something that we can really need to try and do.
Thank you, John. Thanks for listening through the question. Savita?
Just a point of clarification for Professor Bob Smyth. In your presentation, you talked of the regularization of cannabis use being linked to cannabis use problems. So I just wanted to find out on clarification specific regarding the regularization. Was it linked to recreational cannabis use, or was it linked to medicinal cannabis use? So something like that. I just wanted to appreciate.
Yeah, I suppose the key takeaway from my reading of the international literature on this is that as you liberalize access to cannabis, you get more cannabis use. More cannabis use means more problems. And probably the bigger change you get, say, when you formally legalize, it's not that you necessarily get a massive increase in the number of users. What you get in the first instance is a big increase in use by current users. people are already using when it's illegal, start using a lot more, and they start running into more problems. So the data I showed, in terms of that increase in Canada, the number of people who are self-reporting early stages of a cannabis use disorder, that evidence started with the liberalization of access to so-called medical cannabis, and then accelerated further following full formal legalization for adult use. And there's really just pretty much mountains of data pointing in the same direction. And it shouldn't surprise us. It's the same in any other area of public health. We think what we're trying to do with smoking, what we're trying to do with alcohol or any other behavior, trying to reduce access, reduce availability, and increase cost. And what happens with legalization is you increase access, you actually increase the range of products as well, draw in new customers, and you reduce cost. So that unsurprisingly drives up harm. So I don't think it's a wise path to go down.
I might follow up on that. Duke to go to public. Okay, that's fine. My question, and maybe one of the other clinicians might take this, is in light, like reflection Bobby spoke earlier around the legalization and the fallout of that. Now 1 in 6 young people in Canada are smoking cannabis on a daily basis. That normalisation of cannabis use, does that pose additional challenges now for clinicians who are treating either adults or young people in Ireland to take this as a serious issue when it's now freely available in other parts of the world? I'll look at you, Colin.
Glad Bobby's gone now, because I don't think he wants to hear this. I think the cannabis issue is complex now. I think with the increase in THC, it's a different product to what it was 10 years ago. We're still left with the issue as to how we, when people become sick, how we deal with them. And whether we treat people with compassion or whether we criminalise them. And I'm not in favour of legalisation. I agree with everything that Bobby says in that regard. But I think in terms of decriminalisation, I think there's a lot, or the so-called health-led approach. I think, fundamentally for me, we must treat people compassionately. We must not criminalise young people. And it'd be nice to have Bobby here for that and his views. But now that he's not here, it's fine. So but no, look, I mean, I took part in a panel earlier in the year on cannabis psychosis, and it was one of the best presentations I've been to, where there was basically about a young man, a child, 19 years of age, who died by suicide from cannabis stabs. So this is along the lines of what I was saying earlier in terms of the impact. This is so impactful. This is, it's incredibly serious that, we're now dealing with a totally different product in terms of THC content and what it does to young people. I did my training at the Maudsley Hospital. I did on call at King's. I did on call in the emergency hospital at the Maudsley, with the policeman coming in the middle of the night, and young men generally incredibly unwell, and that's due to cannabis, and that had a significant impact on me. We do have this conundrum in terms of legislation and our approach to people who end up in the criminal justice system. How do we deal with these young people? Do we want to criminalise them and not let them go to Australia ever again, or the States, or wherever? I think fundamentally that's wrong. And I also think from a shame point of view that, we should take a health-led approach. I don't think there's anything controversial about that, to be honest. I think the government, recent governments have moved towards that. But I don't know if that answers that question. No return for Bobby, I'm afraid.
It'll do, Colin.
That's right.
And Bobby might be back for his next sentence.
No.
Do you have any other questions from the room? Fiona?
Thank you all very much for a really, really stimulating day, and particularly Tony, thank you. I wanted to ask about the issue of online makes it much more likely to be kept in secret, going on for a long time, and to avoid detection even by your loved ones. And I wanted to ask about age verification, because we know even if we can delay addiction behaviours, particularly gambling, that ability for the young person to have their brain develop a bit more, to access school, to better peers, may change their trajectory. So from a legal regulatory perspective, how hard are we going to go on companies by way of insisting on age verification and having more than financial fines when they're found to have substandard approaches? Because whilst money hurts, they're earning a lot of money, and therefore it needs to be more than that.
So in terms of the legislation, we can prescribe and we will be prescribing exactly what's required in order to open an account for age verification purposes, as I say, which is extremely important, but also in terms of their legal obligations for money laundering, because that has broader implications in terms of Ireland, where to be grey-listed, there's a whole lot of knock-ons there. Age verification and identity verification are extremely important issues, and they're matters that will be a requirement on the various companies. Then your engineering compliance in terms of checking systematically that they're doing what they have said, that they've signed up to do in terms of their license. Now, they would point to the fact that, children will try to circumvent those controls and so on, but they do have to have policies in place to verify and check where somebody changes, for example, to a Revolut account from another account, whereby it's likely to have been they signed up in the name of their parent, but now they're moving into their own name too. That does happen from time to time. So from our perspective, compliance is important, and then your area enforcement in terms of your question. Yes, fines are, I think fines are significant to start with, because, a 20 million fine has a very significant impact in terms of the shareholder expectations and so on. But you can also suspend a license, and that's a very significant issue, or you can revoke it entirely. And then there is the criminal element. So there's up to 8 years provided for, 8 years imprisonment for the offence of involving a child in gambling. So, again, those are matters which we can invoke if the needs arise. Did you want to comment on that in terms of children?
I might just use the example that I've come across, and it's great to hear that there will be age verification, because I think at the moment it's not quite as strong as it could be. I did a school talk down the country, I won't mention where, a couple of years ago, where for the question and answer session, the teacher just stepped out of the room for a second while I asked the students, have you ever gambled before? And they all shot up their hands at 20. It was a small group, so they were very more open to answering questions, and 20 of them out of 20 said, oh, we all have online accounts. And I said, you're all 16, how do you have an online account? And he said, sure, whatever the name of the bookie was, they think I'm 28. And I said, how do you think of 28? Oh, we can manipulate that on our phone. But then the other student said, well, when I was looking to take money out, they very much came down on me looking for the proof of ID and stuff, so they couldn't take the money out. And that meant that they kept the money in their account and kept gambling with the money. And that led to even, all the different psychology involved in developing the problem. So it's really encouraging to hear that we will have proper age verification at the start, but also, there will be fines, etc., if they're not adhered to, because I think young people are a lot more resourceful than I am anyway, that they find ways around everything, same as the gambler will find ways around everything. But also I think it's very worrying in the age we live in, where you can transfer money instantaneously. So we are here, the people are, there's people offering a service of, you send me money through Revolut, I place the bet, take a cut and send you back. So young people are finding ways to get that bet on as well. But age verification is a really positive step, but also sanctions if it's not adhered to, because we do hear that even for someone who is an adult who wins money, there is a lot of hoops you have to jump through to get your money back. If you win over a certain amount of money, it's €2,000. So you have to provide all this information, but they generally don't ask for information on the way in, so we have to kind of balance that up a bit, I think.
Thanks, Tony and Anne-Marie. I think that's going to close our panel discussion session today. And I want to thank you all for your questions and answers. Joining me now and thanking our panelists, Anne-Marie, Evelien, Tony, John and Colin, and of course Bobby, who's absolutely